Hi guys, sorry about that. I seem to be having some technology stuff, but we'll get this right. Hi Kim, thank you so much for coming back. My phone seems to not want to swap screens to do another portrait, but let's try this and see how it's going to go. Hi Melissa, thank you so much for joining us. Hi Tumi, thank you for joining us guys. Hi. I see you guys are on. Hi everybody. Welcome to this live. I'm gonna try and switch my screen around to see if it will work. I'm just gonna wait for the doctor to join us and then we can start. Welcome everybody. Hi Kifilwe. Hi guys, today we're going to be live with Dr. Qinisile, and our discussion is mainly going to be focused around the art of baby making. I've never really done this live with the screen the other way around, so as soon as the doctor changes, I will swap it around and see if it works. Please bear with me because seemingly things are not working as well this afternoon, but I'll wait for you guys to join. Hi. I'm just waiting for the doctor. There you are. I want to try and see if this works. Does it work if I turn my screen around, or are people watching upside down?
We're watching upside down.
And if you turn your screen, are we still upside down with you as well?
Much better, but we just need to see your face. There you go.
Okay.
Awesome.
Sorry, I have to then change my setup because this pod decided to to fall at the last minute, but I will do that.
Yeah.
Can you see me?
There, we see you well.
You see me well?
Can you take it up a bit? Just take it up a bit. Your hand is just a bit cut.
Okay, so.
Or take it closer. Take it closer.
Am I better?
Yay!
Yay! Thank you guys for not hopping off. Thank you for joining us. This afternoon we are talking about the art of baby making, and I'm super excited because I've been getting a lot of women saying, "Oh wow, you know what? We can't miss this. We've got to hear it." And for me as well, personally, in terms of baby making, we always think that it's an easy process. It almost happens automatically, but it actually doesn't. So before we kick off, guys, thank you so much for joining us, those that have joined us. This discussion will be led by the questions that you guys asked, but obviously the ones that we've prepared as well. So, Doctor, I am not going to read your bio. I will firstly introduce myself, then I'll ask you to tell us about who you are. You know, the bio has a woman behind it, and I would like to know about the woman behind the title Dr. Q. So my name is Tumi, for those that don't know me. I am a professional bridal coach, and I'm also the founder of the MisstoMrs Bridal Experience platform, which is really aimed at empowering women, educating women, and entertaining women on their journey to being a Mrs. Because there's so much to learn, so much to prepare, and preparation is really the key to getting your marriage and yourself successful, you know, prepping yourself for success. So all these things that we bring to our audience is really to gear them up for the best version that they could be. So welcome, Doctor.
Thank you so much, Tumi, and thank you for having me. And thank you for such a wonderful platform that you've actually set up. And I hope the ladies that are still looking forward to become mistresses in the future are grabbing as much as they can. I really wish that back in my days, such platforms were actually available. And I know one would have gained a lot. So thank you, hey. Yes.
Absolutely.
Great. And then I just want to say hi to everybody else that has joined us. Thank you, ladies, for joining. I'm Dr. Q. I'm commonly known as Dr. Q, but Dr. Q's full name is Qinisile. It's a Zulu name. She was Miss Tele, so Qinisile Tele to Qinisile Diale, now known as Dr. Q Diale. And I'm a fertility specialist. Practicing obstetrician and gynecologist at Unitas Hospital in Pretoria. I'm also a mother of 4 and a sister to 4. So yes, I've been there, done that, got the t-shirt, and it's a really exciting topic to talk about. It's challenging as well, not just the thrills of actually achieving the trial of actually becoming a mother. So yes, and I'll be talking probably from my own experience, and also, but mainly wearing the cap of a gynecologist and a fertility specialist.
Wow.
Okay.
You're a mother of 4, so when they talk about the art of baby making, you've perfected it, girl.
I've tried it a few times, girl, and you know what? That was not a 9-year career of
Wow.
baby making. A 9-year career to actually get to 4 kids. I even got a discount, so you can imagine it could have been 12 years or something of my life, just going through the baby making journey. And most of it was actually planned, so I know what women are going through. I know what doing a pregnancy test and it comes back negative. I know the feelings. I've been there. So yeah, let's chat about it.
All right, ladies, as we said, we are talking about the art of baby making. And I think for me, the first thing that, it starts with one wishing to have a baby. And not always that couples sit down and discuss our wishes, because I think men and women, we've got a different, maybe not necessarily different understanding, but different interpretations when it comes to family planning. As a woman, you might be looking forward to just having your first baby, and a man might be looking forward to having 5 kids later.
Hey.
So where should couples start? What conversations should they be having when they're planning to have a baby naturally?
Okay, so such conversations are actually great conversations to have even before the marriage. By the time people get into marriage and then they realize that, look, I've always dreamt of being a mother, and that's one of the main reasons, even I'm not saying it should be, but it's one of the main reasons I actually wanted to settle down, and I wanted to have a husband so that we could actually start a family. But you never communicated this to your partner, that you want to be a mother of 5, for example. And then he's here thinking, I'm not ready to be a dad, And we found that in some couples, it's a conversation that is had and embraced, and they walk the journey together. Whereas in some couples, it ends up being the breaking of a marriage, because the guy will be like, look, we got married, now there's 2 kids, I can't handle this, I'm really not ready to be a dad. I'm only 32 years old and we already have 2 kids. I still want to live my life. You find that the guy, or maybe even the woman, was just never prepared for this. So I would really recommend for couples, even at the dating stage, these are the conversations that couples should be having on their dates. It's not just the fun stuff, but we need to get really deep as well into such conversations as to, are you willing to be a mom? Are you willing to be a dad? If the answer is not everybody, let's understand. I meet a lot of women and a lot of men, and not everybody wants to be a mother. Not every woman wants to be a mother, and not every man wants to father a child. So there are some couples that say, look, we agree that we're not going to have kids, and that's it. So 5-year contraceptive plan, you know, let's go. And it's fine. So when couples meet their potential spouse, it's very important to find out, are they on the same page?
Yeah.
Before they even get into further commitment. And after discussing, then it's also very important, when do you want to start a family? Because you'll find that someone else is prepared to come back home at 2,300 hours because they're pushing and they're grinding, and that's what they feel is their time and what they need to do right now. And then also that causes disruptions in the marriage, you know. So what, are you willing to be a mom or a dad? And when are you willing to start a family? And then comes, how many are we looking at? Because then again, you find that couples, I sit with couples where a man or a woman has gone and secretly had a vasectomy, if it's a guy, where he cuts off his tubes and he doesn't tell the lady, because the lady still wants to have 3 more kids or 2 more kids over and above the 2 they already have. And the guy feels he's not coping, and vice versa, where the guy has an idea that it's mostly the men, hey, who want a lot of kids. Maybe there's a reason, you know, they don't go through the experience. I know personally, my husband had this idea of a big family, and I come from a big family, and I felt 2 kids are enough, you know. So we had to compromise. He was like, okay, 4. Then we're like, okay, 3. We both had to compromise and agree on something. And then I got twins. Then it was okay. We went from 1 to 3, you know, and we were excited. But when he got the experience of what it means to be a father, the sleepless nights, the nappies, the milk that you need to buy, or me struggling with breastfeeding or whatever the issues, then, you know, from 4, it was like, okay, you know what, I'm actually fine with 3. You know, the rest is really up to you. So those are the conversations that actually people need to have, and discuss it while it's still early. And also the form of contraception, who will be contracepting? Are we going to be using a condom in between the babies until we decide? Women can sometimes say, look, contraception is making me gain weight, or I get sick, I get abnormal bleeding. I'm not happy with contraception. So what are we going to do? You understand? So those are the type of discussions that they need to have, and it's better before much commitment is actually made into the relationship.
Wow. So now let's just say we've had this conversation. We've both agreed it's time to start.
Great.
As a woman, how best do you then prepare your body for this process? Because I believe that there needs to be some form of preparation of your body, because if I think of myself, I mean, I had my son at like in my late 30s. And
oh, really?
Yeah. You know, he's only 7 now, and I'm 43. So, yes. So I still wanted to travel. I still wanted to be independent. I didn't want to be changing nappies. And we had agreed that we will start late. But I think there's an advantage and a disadvantage to everything in life. So by the time I decided that now I want to have a baby, the body was filled with champagne. How do you then prepare that body to now say, all right, let's get on with it?
Okay, so you know what, it's very important, because women, you know, you see people carrying kids around the streets and begging, you know, and we just think, you know what, it's very easy, just open your legs, baby in, you're done, you're pregnant, you know. And it's really not like that. We must think of baby making as taking care of a field or wanting to plant something. You don't just go into the field and throw the seeds and walk away. You understand? So you need to plow, you need to put manure, you need to fertilize that area, and then make the soil good enough and rich enough for the seed to be planted, and your good soil to embrace that seed and result in whatever product you're looking for. So the same with the womb. You take it as your soil. and the rest of your body, because there are a lot of physiological or normal changes that take place in your body during pregnancy to enable the woman to be able to supply enough blood and nutrients to the growing life that is inside her. So it's very important to know that things like excessive alcohol intake and smoking can go on to form can go on to be dangerous towards the lifespan and the quality of the eggs that you produce. So your eggs become your seed. So then that is actually affected. And also again, studies have shown that even a high caffeine intake can have some negative association with fertility and the long life of the pregnancy as well. So it's very important for women. Number one, the moment you start thinking of actually falling pregnant, go in and get a checkup. There's a lot of women. I was actually calling today because they came in for fertility checks, and only to find, then I had to do pap smears, things that should have actually been doing at least on an annual basis, and only to find that they haven't done pap smears for 7 years or whatever. Now the results are coming back. Now they're starting a family, and the results are coming back saying, look, there's cancerous cells, you know, or there's just abnormal cells that we need to remove. Now I need to do procedures on them before they even go on to start their families. So simple things like getting a pap smear done, because we don't want anything that is life-threatening to the mother. The mother must be healthy enough to be able to sustain the livelihood of a baby. So simple things like getting a pap smear done. Things like reducing alcohol and going on a very healthy diet. And that's just a balanced diet. We don't need women to be starving themselves or anything, just a balanced diet. The women who actually need to watch for carbs or the amount of food that they take are women who are actually suffering from obesity. And that's very important again, because women are of the impression that when you are pregnant, you gain a lot of weight, and therefore there's no need for you to lose weight first before pregnancy because you're going to balloon up anyway. But it's actually the other way around, because when you are pregnant and you are obese, you are actually creating a being genetically that will be associated with obesity as well. So the baby that you are creating, and because with obesity then comes diabetes in pregnancy, comes hypertension in pregnancy, and all these other complications. So then you are creating a baby, you are actually imprinting such genes into the life that you are actually carrying. So it's very important to say, I'm planning a pregnancy, therefore I need to lose weight. And work on your weight and your height and work out the BMI and be of a healthy weight. Okay, so that's just health associated. So then when you come through, we do a sauna. Most women then find that they've got fibroids that are actually affecting them, and we need to go through an operation in preparation of the womb for it to be able to carry a pregnancy, hopefully till term. Okay, so those are the things. Get a simple pap smear and get a sauna, and then we can look at the ovarian reserve and all those things. And then outside health, okay, and then it's very important, at least 3 months before a pregnancy, a woman must be on supplements like folic acid. So those things reduce the risk of neural tube defects or deformities that babies can be born with. So you start at least on folic acid supplements and change your habits, your social habits as well. So it does come with a bit of restriction, discipline, and responsibility of saying, I'm about to become a parent. And again, preparing for finances, because, you know, people have this idea that I would like to deliver in a private hospital or where, but they don't have medical aid, but they are planning a pregnancy. And then you find that a C-section in the private sector is plus minus 60,000 Rand. When you don't have such finances, then it puts a strain on the relationship as well. So personally, I don't invest in a medical aid, because most times I treat myself and I'm a healthy individual. I know the basic things of flus and stuff like that. So, but when I plan a pregnancy, I actually start by sorting out my finances. So I have a, sorry?
I'm saying you make sure that you are covered.
I make sure that I'm covered for it, you know, unless one can say, look, I'm putting aside a nice 60K and 2,000 rand per month to go for each gynae visits and so on. So look at it, you need a nice 80,000 rand plus minus, you know, for you to go through a whole pregnancy. So such finances, this is in the private sector, such finances are a necessity. So then get a medical aid, and the medical aid will give you a waiting period of 6 months. So you see, 6 months before you even plan a pregnancy, you need to make sure that it is financially secure. You get yourself a medical aid if you don't have one, and then you start yourself on those folic acid supplements, change your diet, start taking what you need to take, and then that's your way of actually preparing. One last thing though is, a lot of women then find themselves saying, I'm not ready to be a mom. I want to see the world, travel, I want to climb the career ladder and all of that. And unfortunately, you know, it is quite sad when women come into our offices at the age of 40, age of 44, they are professors, and they say, Doc, I'm ready. And you're looking and you're like, ready for what? Ready to start a family. And the woman is 44. And you do test and the eggs are gone, kaput. And it's unfortunately too late, you know? Yeah. So that kind of preparation, you need to have the knowledge at the back of your mind that the biological clock, unfortunately, is real for us. The men also, but you know, men can at least, as long as they are under 50 years of age, the quality of the sperm also does go to men menopause, but it's much earlier for us. So the recommendation is that if you are less than 35, you may still be safe, but I would just advise women to just get a checkup and look at their ovarian reserve, even if they are less than 35, because then I've had to tell 25-year-olds that unfortunately they don't have eggs anymore. I've had to tell a 19-year-old even that she's no longer menstruating because her ovarian reserve was kaput, you know, she ran out. So that's very sad, and it's very important to actually know that the biological clock is real. And when women reach the age of 35 and they are single, or they still want to be independent and explore with their lives, it's much advisable that they consider egg freezing. So that is something that a fertility specialist will be able to assist them with. They can be 35, freeze their eggs, and when they are ready at the age of 40 and they are trying, and if any difficulties, they don't have to get eggs from somebody else, but they can actually go back and get their own eggs and get them to be fertilized through IVF and ICSI. Okay.
You've said a lot. So in terms of right, you know, you mentioned fibroids, and I know a lot of ladies, you know, it becomes a huge obstacle around. It becomes a barrier to falling pregnant for some ladies. Yes. What are those barriers? I mean, it's the cysts, the PCOS. What are those things that one should be treating first if you know that you already have, let's say, endometriosis or any other underlying issue that will prevent you from falling pregnant?
Okay, so yes, unfortunately, some women only find out of their problems the time that they are actually trying to conceive. And you find that we have to take a few steps backwards before we go forward, you know, which will mean, and very common is the fibroids that one mentioned, because then you find that they can affect fertility altogether, where women struggle to actually conceive, or they conceive and have miscarriages, as long as the fibroids are affecting the cavity of the womb, then they have miscarriages, or it can lead to preterm labor. So there's poor pregnancy outcomes that are associated with fibroids. So it's then you find that we have to go and clean the place up first, get it ready, get it to heal. So that will take you another 6 months of waiting, of getting of readiness, you know, before we can actually get you started on your fertility journey. And I must say, you know, I've seen a lot of good outcomes from my patients whom I've taken to theater, removed those fibroids, and they are actually pregnant. I've delivered a lot of women who actually had myomectomies. They're nervous, they get into theater crying, thinking of the worst. We get in there, remove all those fibroids, clean the womb. A few months later, they come in and they are pregnant, and they take their pregnancies through to term. So it's a very, very exciting experience to go through. And other than that, a very, very common one that is found that most women will not know about until the time they try to actually conceive is blocked tubes. So as women are sexually active, during with sexual intercourse comes the risk that anybody who's sexually active actually takes, which is that of STIs and other pelvic infections. So you find that some women have had STIs. Maybe they were not aware, or they are aware of them, and others will have conditions like endometriosis as well, which will go on and kink the tubes, distort the whole anatomy of the reproductive system. The tubes become kinked. The communication between the tubes and the ovary, the fallopian tubes and the ovary, becomes obstructed. And as we know or may not know, the baby is actually made in the fallopian tube. So that is a very critical organ as far as baby making is concerned. But you will not, most women don't know of what's happening in their fallopian tubes. So you find that if they are blocked fallopian tubes, then women have to go in. If they are swollen and they are carrying signs of infection, then we have to go in and actually remove them surgically, or at least block them from communicating with the womb, resulting in excessive inflammation in the womb, which will end up with a poor pregnancy outcome. So then all that's as far as blocked tubes are concerned. So there's a test where if women are trying to conceive and they find that they are unsuccessful or it's taking time, they can they can actually go for a test where they check the patency of the fallopian tubes. So that's one common issue that actually a lot of our women actually struggle from, which then results in them having to go through IVF. And then there's also issues like polycystic ovarian syndrome. A lot of women actually are not even aware of their diagnosis of PCOS, and it's mostly when, you know, they'll come in and say, yeah, no, I've got beard, and so does my mom and my sisters. It's normal, you know.
We all have it.
I know. You know.
Yeah.
And yes, it is hereditary, but it is associated with issues with fertility. So not every woman that has polycystic ovarian syndrome always struggles to fall pregnant, you know. So there are some that actually then have fertility issues because their body does not ovulate or regularly release an egg for fertilization. So then we also help them. There's ways of intervening medically and or even surgically, where they can be assisted, and other assisted reproductive therapies that we give women with PCOS, where we try to assist them and speed up the process of actually falling pregnant. So I think that will be just to name a few. I could go through a whole textbook, you know, but it's just a few conditions that I think I can just highlight for now, and then most of it can be diagnosed when women actually come in to consult, or some women can actually Google if their symptoms. You know, they come in already knowing, hey, I put in this, this, and this, and then Dr. Google said, you know. So, but then
eggs.
Yeah.
You know, I mean, to carry a baby, we know that your body needs a lot. But I know that you have spoken, I've watched one of your lives about miscarriages, you know, and it is, I think, especially for someone that has never had a baby or they have fallen pregnant before, it's a very traumatic experience, you know. And
It is.
I think purely because nobody expects a miscarriage, one. Two, it's not something that women talk about, you know. I will speak from my personal experience. I mean, I tried after having my firstborn for a very long time. And last year we got pregnant, and just before 12 weeks, I had a miscarriage. I was traumatized.
Yeah.
Completely traumatized. But what I also learned, which shocked me, is that as I was breaking down and chatting to people, I would meet someone and says, "Oh, I've also had 3 miscarriages, or I've had 2 miscarriages," and I was like, "Why are we not talking about this?" Because it is something that you need to be prepared for, because it can happen, but nobody tells you about it. Nobody like prepares you for it.
Exactly. It's like
when you miscarry, what goes wrong?
What goes wrong in the body? Look, and that's a question that a lot of women actually come up with, like, and especially, at least you're saying, what goes wrong in the body? Then others will say, what did I do wrong? You know, where the blame already comes in. And that's where the guilt actually comes in as well. And then the breakdown, which results in the breakdown, you know. And unfortunately, you know, miscarriages, I think maybe it's this cultural belief that we shouldn't talk about a pregnancy early on. Don't tell your friends, don't tell your neighbors, wait until you are 3 months and above, you know. And maybe that also probably comes from the understanding that there is a higher chance of a miscarriage the earlier the pregnancy is. More than 20% of actually, especially it's common in first-time moms, but more than 20% of women actually go through miscarriages. But it's a topic of secrecy, where women actually then crumble down in their own corners, and it's not something that you can talk about, like having a flu. Like, guys, I'm not coming to work because I have a flu. People won't call in to say, look, I've been booked off for 2 weeks, I just had a miscarriage. Somehow very taboo and very secretive. But there are multiple causes of miscarriages, and I always stress and emphasize that women should not blame themselves. Sometimes it may sound maybe a bit cold, but I would tell them that sometimes, you know, the miscarriage is actually saving the woman or the couple from a bad outcome. You know, it's like getting a tire burst when you rush to a meeting and you're late for a meeting, and you maybe end up being late only to find that there was an accident that actually happened at the place that you were going to pass at that time that you were going to pass. But that tire puncture actually became like your lifesaver. There are many couples that go through pregnancies, the body misses the abnormality and does not discard the pregnancy. And then you are 20 weeks pregnant, it's visible, you're going for your consultation if delayed, and you're told at 20 weeks that the baby doesn't have brain matter, that the baby is abnormal. And then the only way to actually continue is to terminate the pregnancy, because the baby won't have a good quality of life. The baby is severely disabled. So there's already been some excessive bonding, you know, prolonged bonding and all of that. So most of the miscarriages that happen, especially in first trimester, are associated with chromosomal defects, where it's either there was an excess chromosome during the time of the division of the egg and the sperm, because they have to divide in half, and then the 2 halves join. So you find that there's an extra chromosome then the baby can be born with excess limbs or anything that could have been wrong. So the body then is able to detect the faults, like a factory fault, and actually eliminate that pregnancy whilst it's still early. So then if we don't test the products of that pregnancy, we will not even have a confirmation that yes, there were some chromosomal abnormalities. So the body is able to detect this pregnancy is actually abnormal and able to expel it. And sometimes you find that there's just no heartbeat, maybe at about 7 weeks or 9 weeks. And then most times it's actually clotting factors, where conditions like antiphospholipid syndrome are concerned, and then you find that the baby does not get a blood supply. So the womb that is actually supposed to get blood vessels that feed the fetus actually gets clotting, and then you find that the baby does not grow very well. And there are other issues as well, like diabetes. If a woman has not is not even aware that she's diabetic as yet, things like diabetes and other things like hypertension that actually can also complicate a pregnancy and other different things. So it's very important to, when we investigate for miscarriages, if it's one miscarriage, it's taken as common and we don't investigate much, because it also costs, it also can become very costly to investigate all the different causes of miscarriages. But then once a woman has 2 or more miscarriages, that's when we say it's actually recommended that we look back and say, what is it that could have caused it? So we do bloods, and then some women, if they've never gone through a full-term pregnancy and there's 2 miscarriages or more, there may be abnormalities in the womb. And it also depends on the type of miscarriages that they have. So it's very important to have a thorough history of how did the miscarriage happen? Did the sac just fall out, or did you just start bleeding and it was clots and you were clean? Because there's also issues of cervical incompetence. We ask, did you have pain, or what exactly happened? And then we can actually put in a stitch to actually keep the pregnancy a bit longer with the next pregnancy. So a lot of things could actually be associated with a miscarriage, and it's very individualized.
Yeah. So if I'm ready to fall pregnant, I know this is very tricky for a lot of women, and maybe you can give us a simpler way of doing it. How do we count our cycle to know the best time to be active and making
fun,
to be back in there?
Yes, so it's very important to know when to dance. I tell my patients that, look, you only have 48 hours in one cycle to actually fall pregnant. And women don't know that. They think the egg is always there the whole time. Anytime it's tea time, you know. So the egg just pops in, says, hello, 2 days, I'm gone, you know. So when do you know? When is this 48 hours? When is the egg actually there waiting to be fertilized? And that all begins by knowing your cycle, knowing your menstrual cycle. So I recommend that women actually keep a calendar. So these days, life has become much easier. Women can actually get applications, ovulation app. I get women to download some of them when we go through the technological aspects of it. So women can download an ovulation app, where you can put in the first day that you see your blood is actually day 1. So that's how you count. Day 1 is the first day that you see a flow of blood, not the spotting and all of that. So that's day 1. Then day 2, day 3, if your menstrual bleed lasts for 3 days and you are done on day 4, you keep counting day 4, day 5, until the day that you see your next period. So the day before you see your next period is the last day of your cycle. So a cycle means from one bleeding day to the day before the next bleeding day. So women always think all of them have got 28-day cycle, you know, and it's not really like that. Not all of us are fixed to a 28-day cycle. It's an average for most women, But some women have got a 30-day cycle. Some women have got a 34-day cycle, and others a 26-day cycle. So a cycle is said to be normal if at least it's above 21 days, and if it's less than 35 days. So 21 to 35 days, you know you have a normal cycle to begin with. Now, if you know how long your cycle is, then you can be able to predict your next cycle if you have regular periods. So you need to monitor for at least 3 months. Then you can see a pattern. Okay, this month it was 27 days. The following month it was 27 days. Oh, I've got a 27-day cycle. Oh, some women then will say, look, my periods are irregular. It's 26, it's 28, it's 30 or whatever. But at least have an idea. The shortest cycle I have is 26 and the longest I have is 30. All right. Now, when we count or calculate medically, every woman is said to ovulate, to release the egg at least 14 days before the next bleed. So that is fixed for most women. So if you have a 28-day cycle, it means 14 days before the 28-day cycle, you will be ovulating. So then we will tell a woman, count back, so count forward when your next cycle will be, predict your next period, and then count 14 days back. And then you'll know that's when you are actually going to ovulate. Then you can have intercourse 2 days before, so that there's nice sperm. That is, sperm can last for up to 5 days in the fallopian tube. So drop some before, drop some during, and drop some at least the day after your ovulation. Then you know you've timed around the time of ovulation. So that is the cheap, the most affordable, the easiest way of actually just doing it yourself. But if you feel, look, the counting and this, and most times when I explain this, it's the men that get it better. And they end up being the ones saying, yeah, no, the last period was when, and then, yeah, so you ovulating then, baby, ne? Okay, we're doing it, ne? I'm coming back home in. Okay, so, which is fun. I enjoy it that way. But then women can then go on to buy an ovulation kit, which they can get at any pharmacy. It's an ovulation kit where they can start at least from day 10 on average. But then remember the 14 days backwards. So if you have a 21-day cycle, then you need to start a bit earlier. Even by day 6, you need to actually start testing your urine. So you wake up every morning, you dip as if you're doing a pregnancy test, and then you test your urine, and you see if there is a hormone that is released by your body when an egg is released. That hormone is in your blood, then blood goes through the kidney then releases the hormone in the urine. So if you're able to pick up that hormone in the urine, then you know that your body has released an egg, and that's the time that you have to actually plant that seed, have fun, and do a pregnancy test when you miss your next period. So that's just the simple ways of actually trying on your own and naturally. So that's the timing of ovulation. The key period is the timing of ovulation. And if you don't want to time and whatever, you will hit it right if you have sexual intercourse at least 3 times a week. Somewhere there, you will be able to score. You don't want to make it a chore or something like that. So yeah, just in simple terms, without me complicating things.
Okay, so let's just say now you have tried for a long duration, and I'll define a long duration for over a year or a year and a half. I would think it's a long duration.
It is.
Yes, and you're not falling pregnant. After, do you think a year is enough, or after how long do you think one should escalate to a specialist? Now, we've been trying it ourselves, timing everything. It's a year later, I'm still not pregnant.
Good. So yeah, a year is a good time to actually go on and consult, because that now qualifies the criteria of what we call infertility. So if a couple has been trying to fall pregnant for 12 months with regular intercourse, which is at least 3 times a week, and without any contraception for a year, then that couple actually fulfills the criteria of what is said to be infertility. And that's when now intervention, but before intervention, further investigations are required, and then intervention accordingly. So yes, at least after 12 months. But there are some couples that say, why must I wait until a whole year is over before I know? Then after trying for a year, then only I find out that I have a problem. Then only I start, because now I'm going to delay the whole process. But it's also a matter of affordability. So there are some couples that try for 6 months and they say, nope, I'm not going to wait for the rest of the 6 months. I want to know if my tubes are open. I want to know if my womb is okay. Do I even have eggs? You know, rather I find the problem earlier than waiting for the 12 months. But then again, as I say, we won't say let's intervene if there is no need for intervention. So if I check you and everything is fine, then I can just reassure and say, you have another 6 months of having fun. Just go out and try, you know, and then let's see, because it takes about 12 months for at least 80% of the couples to fall pregnant. So people must not be impatient with themselves. It's not that every time we have sex, we can easily just fall pregnant like that. You know, so sometimes it just doesn't happen. It's not a good quality egg, you didn't ovulate or something like that. So there's multiple reasons, and it's not just once off that you fall pregnant. It does take at least a period of 12 months of effective trying.
So guys, thank you so much for joining. Do you have any questions, guys? Please do pop them in the comment box so that we can answer them. Any questions that you have for Dr. Q? She's here. She's a specialist. Her rates are very high. I'm joking.
Oh, really?
But now that we have her here for free, make use of this time, guys. Dr. Q, where is your practice based?
I'm based in Pretoria, in Centurion, and it's in Unitas Hospital. Just the wing of Unitas Hospital is called Lifestyle Management Center. So that's where my offices are, Centurion, Unitas Hospital.
All right.
That's where we practice.
I hope it's not too late for me at 43. Will I be giving you an...
Hey, no. I've got a 44-year-old that's currently pregnant, that we assisted with a pregnancy, and yeah, and fortunately enough for her, even it was her own eggs. So, and we are going strong with that pregnancy. We did Down syndrome screening, low risk. So hey, you don't lose hope.
When we talk about you know, babies late, we know that women these days are having babies late. What are the implications, you know, so that everybody's clear on the choices that they have? If I have a baby early, you know, chance of everything going right are higher. If I have a baby late after 35, what are the, you know, the risks that I'm putting out there for me as a person and for the baby?
Okay, so starting with the mom, you know, women are, that are above 35 with age, you know, even naturally, leaving pregnancy aside, then women start getting hypertension because of their lifestyle or maybe hereditary or anything like that. So whether or not you are pregnant or not, so already that hypertension and those diabetes and all those things you are at a higher risk of developing such conditions, and that also can complicate the pregnancy on its own. So women above 35 have been found, their pregnancies have been found to be associated with what we call preeclampsia, which is severe hypertension in pregnancy. And then again, there's a high risk of miscarriages. You know, it's said that women that are above the age of 40 have about a 40% chance of actually having a miscarriage. And this has to do with the maturity of the eggs, because the eggs are as old as we are. We don't make new, fresh eggs every month. We are born with the eggs. They are actually even older than us, because we start counting our age when we are born. But the eggs were already dying on the inside of us when we were still in our mother's wombs. So the eggs are actually much older. So if you make a baby with a 25-year-old egg and a 45-year-old egg, there's a big difference. So then there's risk of actually abnormalities also of the baby, things like Down syndrome and other trisomies that are associated with that. So those are the risks that actually one stands to encounter, which becomes higher with an increased maternal age.
Okay, we've spoken a lot about women. When do you investigate the men?
Yes, so yes, they also need to come in. And it's very quite sad because, you know, there are couples that come in and it will be understood that the woman has a problem because the guy has got 2 kids with in his prior relationship, and he's actually doing fine. So I've come to help her conceive, you know, as the guy comes in. And we test the sperm, and only to find that, yes, you are fathering or supporting 2 kids, but you've never had sperm. You were never born with sperm. The testicles are still in the abdomen or stuck in the groin somewhere. And this woman is actually being faithful to you to say, there's actually no sperm. We can't have kids. And then now it becomes a problem in the relationship to say, what do we do with these kids that you've been fathering for the past 10 years? With the understanding that they're yours. So it's very important that men actually also come in because there are some factors where then, besides not being born with having sperm, then they can also have poor quality sperm. This can be due to excessive alcohol intake or smoking, and even things like aging. As I said, there is male menopause as well. So you find that the quality and the quantity of the sperm is actually affected. And some men, they're young men, they're healthy, but their sperm quality is low. So there are supplements that we are able to give them, and then you find that after a few months of actually being on the supplements, they can actually father a child. And if we find that there's issues with the sperm or absence of sperm, there's options of sperm donation that we actually offer the couple. They go home and they discuss, and then it's something that is kept within the clinic where we actually get a sperm donor to donate sperm, and they are able to actually conceive together.
Sure.
So they do come in.
So I just want to understand something. If somebody has a missing sperm, do they still ejaculate, or like there's ejaculation, or it's just water that's coming out? What is what comes out?
What comes out when a man ejaculates is semen. So we call it semen because it's got fluid that comes from other glands as well, like the prostate gland, you know, that actually releases into the same tube as where sperm actually goes through. So the liquid there contains supplements, it contains nutrients, it contains sperm, and it contains other glandular fluids. So what can come out can be there, you can see the semen, but when we go under the microscope to look for sperm, there's actually no sperm swimming around. We look for those swimmers and they're very busy, and the multiple dots in the fluid, and you find that it's actually clear fluid without any sperm activity. So yes, the men can ejaculate, but there is absence of sperm.
Okay, so from my side, lastly, what advice would you give a woman that feels they're just about to give up? I've tried and I've tried and I've tried, and yeah.
Okay. So, you know, I've come across a lot of women where they will say, you know, and then you ask, okay, how far did you go? Where did it say? Arai, negitesta, utestile, okay, na robala le monna hae fela, and that's it. Ha tsebe gore ovulator ning, ha zanga etsa ovulation kit. You'll even ask, so how many IVF cycles have you gone through? Are you 12? You know. So firstly, before a woman gives up, she must be aware of how far has she gone, how much effort has she put in, and what options are there that are open to her that she has not tried. You know, a lot of women actually limit their options and then end up broken, and it's something that others then take throughout their lives. Other women just end up bitter throughout, and they're not even aware, but it's because of this subconscious unfulfilled yearning that they actually had. So I would say let them first reach out to somebody, because it also has psychological impacts. Women get called names and all of that. Let them reach out to somebody, be it a trusted friend, be it a professional. You know, there are psychologists that actually help couples to deal with this, because it even ends up being a strain on the relationship where you know, there's a stigma that's attached. The in-laws actually get involved. So get all the support that you can get psychologically, and then if it means you put money aside for you to get the assistance that you need in terms of assisted reproductive therapy, women must not look down on such assistance that is actually available. And if anything, I would like to show you a picture of our 40-year-old mom, first-time mom after 10 pregnancies. So they are holding their baby. Look at those smiles. Look at that smile. So this is a couple that said, we are prepared to go out and show the whole world and tell the whole world that, look, we've been on this journey for more than 10 years. They've tried IVF in 2012. It was unsuccessful. They had triplet pregnancy where they ended up in a miscarriage, unfortunately. They've had ectopic pregnancies, you name it, you know. And last year, July, they actually came to my practice. They were sent by their gynecologist to me to say, we are ready to try, but we are told our tubes are blocked. When I assessed their tubes, I found that they were full of fluid, massive, quite destroyed tubes. And I took them into theater and we had to remove those tubes. And I said, our only way forward now is going to be through IVF. And we worked through IVF together the following month after the operation. So that's what I mean, where we have to take a few steps backwards before we actually go forward, you know. So we went through IVF last year, and they conceived a singleton pregnancy. And now this is baby Unalina, where after 10 unsuccessful or pregnancy losses, she is carrying her very first child. And this is really a gift from God. Her name is Unalina Kanyisile. And so I just hope this story gives somebody hope to say, look, I haven't gone through 10 pregnancy losses. Look, I haven't even done one IVF cycle. Some people are successful. With them, it became 100% success rate, you know, because it was their first attempt with me, and they were successful in conceiving with that one cycle. With others, maybe it's a second cycle where they'll be successful, you know. You need to go through, you know, they say it's usually that last key in the bunch that actually opens the door. So let the women not lose hope. And if they've tried everything, you know, let them again go back to the creator of all things, because we can put all things together and put things that all ducks in a row, and it's really, it is him that actually gives life. To say, Father, what your will is over my life, and you take it from there.
We have a question here. I'll tell you, it says, if one has 10-year copper T in the womb, will I fall pregnant if I remove it? 10 years it's been there.
Look, a long-term intrauterine contraceptive device is associated with some infections in the womb. I won't give those big names, but it is very important to actually go and get tested. Number one, you need to remove it. It will be good to actually give your womb a couple of months to heal. There is a test that we can do to check if that infection is there or not. And then, yes, it is still possible to fall pregnant, provided that everything else is fine. You are still young, you've got good quality eggs, you don't have other illnesses, and so on and so forth. And there's a good sperm to actually assist with the conception. So yes, it is still possible, as long as there's no infections, and if there's infections, we treat.
Okay, and then somebody else was asking if they go through IV, is it possible to have triplets? I get a guarantee if I just want.
And let me say again, there is actually no guarantees in IVF. There's no guarantees that you're going, if we put in 3 embryos, it doesn't guarantee 3 babies, you understand? And besides, high pregnancy orders are not recommended. Things like triplets are no longer recommended. The best recommendation is to put in 1 embryo, because that gives a quality pregnancy. The moment we put in 3 or whatever, we are risking your life, we are risking the lives we are trying to create. Again, remember, we want to get a quality citizen, a quality baby, you know, who will go on to be a good citizen of the world. So if we compromise the environment of the baby just from the word go, you know, it's actually not recommended. So triplets are a high order pregnancy, and those babies end up in ICU. They hardly will reach even 35 weeks, you know, so you get preterm babies going to ICU, stress on the mother, and all those other factors. We do put in at least 2 embryos. It depends also on the age of the couple and what is found in the lab and all those things. So unfortunately, I'm not going to be here and say, yes, we guarantee you triplets. No.
Yeah.
Number one, we don't recommend them for your sake, your health, because again, there's hypertension risk and all those things. And then for the quality of the baby also that we want to produce. And then, yeah, so at least twins. But again, there's no guarantees. We can put in 2 embryos, get 2 babies, God willing, or get 1 baby, or even be unsuccessful even after putting in those 2 embryos. So couples must come in prepared and knowledgeable of the possible outcomes that one can have from IVF, and be realistic about everything as well.
Wow. Thank you so much for this insightful conversation. I mean, I've learned a lot. I'm not giving up. And yeah, and I hope and trust that this conversation has given somebody hope. They've given somebody clarity and direction in terms of their family planning. And it's actually empowered somebody out there that didn't have the knowledge, you know, and they've got something out of this conversation. Thank you so much for your time. I really, really appreciate it, and I'm sure that a lot of ladies really appreciate it. That's it from my side.
It's a pleasure. You keep well.
Keep well. Bye, everyone.
Bye.